stable pigmentation. If it appears, it's very difficult to disappear it. It's a problem for patient, and even from lentigo. Lentigo also could be transformed in melanoma. Even we have melanoma, subtype of melanoma, lentiga, malignant melanoma, because it looks like lentigo. Is it clear?
Yes, ma'am.
Yes. Okay. Okay, do you have questions about local hypermelanosis? No. Okay, therefore,
No.
let's talk about hypomelanosis, yeah? Decreasing amount of melanin, yeah? It could be acquired just two kinds, yeah? In classification, general and local, yeah? General, it is always hereditary. It is albinism, yeah? If a patient doesn't have melanocyte, or they are not functional exactly, yes, they don't give function, they don't produce melanin, and therefore it has very white color of the skin, red, exactly, red eyes, yeah, because any pigment, just vessels we can see, yeah, in the eye. The same according to hairs and another. Everything is white because of absence of melanin, total absence of melanin. Yeah, and local, it could be very often acquired, appears exactly, yeah, and progress. It could be endocrine system disorder, or after some trauma. It could be if in some region patient lost melanocyte. Yeah, in this region it will be a white color area, depigmented area, yeah, without any pigment. And the name of this area, the name of this, the term of this pathological condition, which exactly when we can see this area of depigmentation, it is vitiligo. It is written like, yeah, like Latin V-I-T-I-L-I-G-O, vitiligo. It is specific, exactly specific term according to local hypomelanosis. Is it clear?
Yes, ma'am. Yes.
Yes. Okay, do you have questions about proteinogenous pigment disturbances?
No, ma'am.
Ma'am.
No questions, yeah.
Teacher, there is another leukoderma.
Yeah, it is leukoderma. It is old term. Yeah, in exactly in modern science, usually we use vitiligo, and but pay attention. For example, in dermatology, leukoderma term dermatologists use according to syphilis. In syphilis specific depigmentation, dermatologists name as leukoderma. In another diseases, it will be vitiligo. Is it clear? But for pathomorphology, it doesn't matter. For us, it doesn't matter the cause. Yeah, just in terminology, some disturbances we have.
Teacher, vitiligo, it is an autoimmune disease. Due to
Often, but
autoantibodies.
not always. Not always. Yeah, it's very often autoimmune or genetic. Exactly. Yeah, the hereditary disease. Endocrine disturbances very often. Yeah, but mostly it was described and investigated autoimmune origin of this disease, and it's very difficult to treat it at all. Yeah, but and we can change. We cannot change this situation. Yeah, if it appears this depigmented area, it means that melanocytes are absent at all. It's impossible to implant melanocytes. Yeah, because the reserve cells exactly are absent. just some makeup, like some permanent makeup, some injection, exactly, yeah, injection of pigment in it in time can help. The task of doctor, yeah, for vitiligo to stop of progression. Yeah, we use different treatment to stop of enlargement of this depigmented area, because it means that exactly patient is losing melanocytes. Melanocyte will die. Yeah, therefore our task to stop this apoptosis, like apoptosis development, yeah, because sometimes we even don't know what does lead, why does it happen. Very often it happens, unfortunately. Yeah, if it was trauma, it's understandable for us, and we understand that this area it's impossible to have this, but progression can't develop because it was trauma. But if it is autoimmune disorder, if it endocrine diseases, yeah, we should use some specific treatment according to it. Okay, what else? What another questions do you have? Do you have questions?
No, ma'am.
No. Okay, next. What should we talk? We have finished with pigments. Yeah, exactly. Yeah. And now let's talk about nucleoproteins, because except pigments, also you have to know about nucleoprotein disorders. There are 3 diseases exactly, yeah. Gout, yeah, do you remember them?
Yes. Yes, ma'am. Accumulation of uric acid.
Uric acid infarction, and stone, urolithiasis, or stones in exactly in kidney, yeah, kidney stones we can use. Urolithiasis, it means, yeah, kidney, yeah, urine system, and lithiasis, lithium means stone, yeah, kidney stone disease. The main fruit, and exactly you have, no, you will have questions in every of them, yeah. Uric acid infarction develops exactly in newborns because of hereditary severe metabolic disturbances, and morphologically we can see infarctions, kidney infarctions, because of blockage of ducts, because of this salt accumulation, yeah, and newborn has a severe kidney failure because of it. Therefore, the name of the disease is, the name of this condition is uric acid infarction. Very difficult condition, yeah. Next, about gout. Yeah, gout is also characterized by uric acid salts accumulation, formation of these deposits. But before, in gout, and also clinically we can identify it, increasing amount of uric acid in the blood and increasing amount of uric acid in urine, yeah. And you have to know terms. How should we name increasing uric acid in the blood? How should we name it?
Hyperuremia.
Hyperuricemia. Hyperuricemia. And hyperuricuria, it is about urine. Hyperuricuria. Yeah, is it clear? And except this blood changing, yeah, biochemical changing in the blood, also we can see deposition of salts, uric acid salts around joints, yeah. and patient has severe pain because this acid irritates tissue around this joint, skin, subcutaneous fat tissue, all this muscle tissue, they are irritated and injured by uric acid, and patient has severe pain, and we can see deformation of this joint because of salt formation. Yeah? Usually it caused by using, if patient, for example, if patient disturb exactly diet, yeah, if he ate meat, first of all, it is exactly proteins, yeah, proteins from meat and another kind of this food, yeah, they should exactly be strong in diet. Because in disturbance of diet, exactly this problem happens. This deposition starts. The same uric acid stone deposits exactly we can see in kidney. In kidney happens the same. As a result, kidney failure and kidney deformation, some fibrosis, sclerosis, cyst formation in kidney develops because of these disturbances and blockage of tubules, renal tubules, because of uric acid depositions. Okay, is it clear?
Yes, ma'am.
Yes. Okay, what else? From mineral disturbances, you have to pay attention to copper disorder. You will have the task about it, and calcium disorder. It is the main. From minerals, what should you know? Yeah. Calcium disturbances, it is calcification or calcinosis. Yeah, calcification, calcinosis, it is the same. It means accumulation of calcium salts. You have to know classifications. There are 3 kinds of calcification, yeah, and you have to know specific staining. How can we understand that? In H and E staining, calcium salt deposition, they are dark violet. It helps us, but we can use cause reaction, KOW. You had this task in your distant work, yeah? Have you seen it? You had the task about clinical task with cause reaction. It was used cause reaction, yeah? And the question, what pathological process is it, yeah? Cause reaction is positive in calcium, according to calcium salt deposition. Therefore, we use cause reaction equal to identify calcium deposition. There are 3 kinds of calcification or calcinosis. Do you remember them?
Metastatic,
Dystrophic, metabolic.
And metabolic. Okay. Just one of them is local. Local, just in one place. Which of them?
Dystrophic, ma'am.
Dystrophic. Dystrophic happens because of dystrophy and necrosis. It was accumulated, yeah? You will study, you will prepare for the next lesson, yeah? It will be, and you will study exactly necrosis, and except types of necrosis. Also, it's very necessary to remember outcomes, yeah? What can happen with dead tissue. And as general 12 outcomes, you have 12 ways, what exactly, 12 situations, what can happen with this dead tissue. And one of them is petrification. Petrification, it is the same as dystrophic calcinosis. Yeah? Because it is local, it exactly happens because of dystrophy and necrosis, exactly. Instead, dead tissue, or exactly this dead tissue, are impregnated by calcium salts, and this calcium salt deposition, we can see instead dead tissue. This petrification or dystrophic calcinosis. Metastatic calcinosis, only metastatic calcinosis, is characterized by hypercalcemia. And very often it happens because of bone tissue injury in some diseases, osteomyelitis, for example, or another endocrine diseases which are characterized by destroying multiply myeloma also, destroying of bone tissue, and from bone tissue calcium goes in the blood and we can see hypercalcemia, and from blood calcium goes in another tissues in the vascular wall and accumulates in it, and we can see metastatic general, therefore a lot of deposition in different organs, in different vessels, everywhere. It will be metastatic calcification. Metabolic calcification caused by intestine disorder, if absorption of salt and calcium is disturbed, and because of it calcium and another mineral disturbance develops, and calcium deposition we can see. Is it clear?
Yes, ma'am.
Yes. Okay, and the last, also you have to know about copper disturbance. What name has copper disturbance disease?
Wilson disease.
Wilson's disease. Wilson's disease, which characterized by copper accumulation. It happens everywhere, and clinically we can understand according to accumulation of copper in the eye, as a ring, Kaiser-Fleischer ring, It will be the color of eye, it becomes bronze, because of accumulation of bronze shiny, because of accumulation of copper. It's very important. And also usually copper is accumulated in the liver and brain. Therefore, another name of Wilson's disease is hepatocerebral dystrophy, because mostly we can see cirrhosis, liver cirrhosis because of copper deposition, and brain injury. Even sometimes patient can have psychiatric disorder. Psychiatric can treat this patient a lot of years, but in truth, excessive amount of copper, I don't know from where, but it is accumulated and lead to this psychiatric disorder or another kind of neurological clinical feature. It depends where deposition develops. Okay, do you have questions?
Ma'am, can you please explain the specimen of brown lung of brown induration of lung?
Brown induration of the lung. At the same time, we can name it as hemosiderosis of the lung. Is it clear?
Yes, ma'am.
But in truth, brown induration of the lung, it has two processes, hemosiderosis and sclerosis at the same time, brown induration of the lung. Therefore, in this situation, we can see lung a little bit is enlarged, a little bit rounder, margins are rounder. It has dense consistency. It has brown color. And macroscopically we shouldn't see more, yeah. Microscopically, in alveolar walls and in alveolar spaces exactly, we can see accumulation of brown pigment. Brown pigment are accumulated extracellular exactly in space, and also inside in macrophages we can see. Yeah, the name of these macrophages are siderophages and sideroblasts. Two kinds of cells we can see. Yeah, both of them are macrophages, which contain hemosiderin. The difference between siderophage and sideroblast, it is exactly how hemosiderin appears in macrophage. If macrophage have engulfed this hemosiderin, it is siderophage. And if macrophage produce this hemosiderin, it is sideroblast. Firstly, exactly we can see accumulation of macrophages. Macrophages engulf exactly and becomes siderophages. But later, a lot of macrophages exactly come in this region because of excessive accumulation of hemosiderin, and some of them start to produce hemosiderin inside. And in this situation, it's like a sign of progression. And the macrophage which produce exactly this hemosiderin, it is sideroblast. Is it clear?
Yes, ma'am.
Okay, and how can we recognize it? We can see brown pigment in them. We have to use Perl's reaction microscopically, and Perl reaction, Persian blue reaction, gives blue color, and according to it, we can understand that it is hemosiderin. But except the hemosiderin accumulation, also we can see sclerosis, overgrowth of dense, mature connective tissue, which gives exactly hardening of the lung parenchyma. Is it clear?
Yes, ma'am.
It happens because of congestion, blood congestion, venous blood congestion in the lung.
Okay.
Chronic, exactly chronic congestion. Okay, what else? Another question.
Teacher, what is the difference between lipochrome and lipofuscin?
Lipochrome, we can see they have a different molecular structure. Yeah, morphologically they are similar, just according to reason. Yeah. And according to lipochrome, lighter, it has yellowish color. Lipofuscin is brownish, more brownish color. Yeah, but it is subjective difference. First of all, it is according to the cause. Because lipochrome, exactly only in some diseases we can see this lipochrome. It happens rare, but lipofuscin, it exactly in atrophy, in exhaustion, in old patient. Yeah, it's like pigment. Another name of this pigment of oldness. Yeah, because in old patient, with aging, we can see lipofuscin accumulation.
Okay. How is lipochrome produced? Like, what are the reasons for this?
Because of exactly ultrastructure disturbance also. Another biochemical mechanism, yeah, and therefore biochemical structure of pigment is another. There's a biochemical difference between them and cause. They have different causes. If I find more information, I will send you exactly directly. But usually if we are talking about lipidogenous pigment, because lipochrome, and at the same time we can see a few lipochrome and lipofuscin. Yeah, in this situation, if we can see lipofuscin and a few lipochrome, we have to put diagnosis of lipofuscinosis, brown atrophy.
Ma'am, can you please explain the brown atrophy of heart?
Description, you mean?
Yes, ma'am.
Some of students gave me full description. Brown atrophy of the heart. The heart is decreased in size. It's smaller. It is V-shaped, yeah, because apex becomes more acute. It is V-shaped. From outside, exactly, we can see coronary vessels. Coronary vessels are prominent. They are visible because of subepicardial fat, adipose tissue absence, yeah, because it disappeared. And we can see coronary vessels. In healthy heart, we shouldn't see coronary vessels. In cut surf, if we cut exactly myocardium, we can see that myocardium is brown. And we can understand why is it brown. In microscopical investigation, we can see lipofuscin, brown pigment granules accumulation in cytoplasm of cardiomyocytes. Okay, what else? Also, yeah, I didn't talk about, yeah, after we cut, we can see that exactly the heart wall is thinner, yeah, thinner than normal. It is weak, like flabby, yeah, and we can see brownish color. Okay, what else? What another questions do I have?
Ma'am, what about aortic atherosclerosis? Description.
Exactly, atherosclerosis or lipidosis, because they have different description.
Atherosclerosis.
If we are talking about lipidosis, it will be as example of stromal vascular dystrophy, yeah, exactly cholesterol accumulation. In this exactly in this macrospecimen, we can see yellowish patches, yellow stripes, exactly, yeah, in the aortic wall from inside, from endothelium side. And aortic atherosclerosis, aorta is deformed, yeah. It is, we can see irregular thickness of the aortic wall. It is deformed, it isn't smooth, it isn't exactly, in some region it is narrowed, yeah, lumen is narrowed, in some region it is expanded, therefore deformation. Aortic wall, it's hard. Sometimes, like, we can see like stone formation in it, yeah, and in some regions we can see local thickening. This local thickening, they are atherosclerotic plaques, which exactly consist of lipids and connective tissue growth. If we cut, yeah, if we dissect aortic wall, it will be very hard, and even some like stone, like if we cut stone, we can see specific sound, the same sound we can
हाँ इधर ना पीछे से आवता है थे हम लोग कुछ ना सा एक सेकंड के लिए कैमरा बंद कर रहे थे फिर आगे थे बात कर रहे थे कैमरा बंद
the same sound we can hear if we cut this exactly atherosclerotic changed aorta.
Okay, ma'am. Ma'am, how it is
Yeah.
different from aortic atherocalcinosis?
It is exactly aortic atherocalcinosis, because the last stage of atherosclerosis is atherocalcinosis. It means in the last stage